Okay, so now let's proceed on discussing the micronutrients. Okay, micronutrients, okay, unahin natin yung ating vitamins. Okay, vitamins is a complex organic compound which is used to regulate body processes and maintain body tissue. It is needed in small quantities for normal metabolism, growth, and development. Vitamins comes from the Latin word vita, meaning life, okay, and the suffix amine means nitrogen compound. It was discovered later that not all vitamins contain nitrogen. Nevertheless, vitamin has been used pervasively and has become a common word. So, vitamins do not give body energy. Si micronutrient, yun ang difference ng ating macronutrients and micronutrients. Macronutrients are major suppliers ng ating energy sa ating katawan. But our vitamins and minerals, which are micronutrients, sila ay tumutulong sa mga body processes and they do not yield energy. Hindi sila nagbibigay ng energy sa ating katawan. But they help our body to process chemical reactions or they help our body grow more. Okay? So vitamins do not give to the do not give the energy to the body. They merely help convert food into energy through many biochemical reactions. So terms associated, let's discuss the terms associated with vitamins or vitamins terminology. So we have here the precursors or provitamins. These are substances that can be converted by the body into active vitamins. So these are compounds that can be changed. Kumbaga na, uh, hindi pa sila active, kumbaga, sa ating katawan, pero pwede natin silang palitan, okay, at i-convert into active vitamins. For examples, okay, we have carotene, which is the carotene, it is converted to vitamin A in the intestinal way. We have also the tryptophan, which is converted into niacin with the help of enzyme system. We have also the 7-dehydrocholesterol, which is converted into vitamin D with the aid of ultraviolet light in the skin. Okay, so yan yung tawag sa ating precursors o provitamins. Again, so we have here also preformed vitamins. Preformed yan na, sorry. Sorry for the one. Preformed. Okay. Preformed vitamins. So these are naturally occurring vitamins that are in active form and ready for biological use. Again, they are naturally occurring vitamins in an active form and are ready for its biological uses. So example are the animal sources. We have here also a vitaminosis. Okay, a vitaminosis. This refers to a condition resulting from lack of a vitamins. Kumbaga na may kulang na vitamin. In the later stage of this condition, when more defined signs and symptoms occur, a nutritional deficiency disease is recognizable. For example, a vitaminosis A can lead to night blindness, and then a vitaminosis C can lead to scurvy. And then vitaminosis B can lead to beriberi. Okay, so we have here also hypervitaminosis, which is this is sometimes referred to as vitamin toxicity. Okay, having too much of the vitamin which is harmful to the body. So sobra-sobra yung vitamin niya sa sa kanyang katawan, that would lead to toxicity. Okay, we have also vitamin malnutrition. The prefix mal meaning bad. Okay, it denotes bad, which denotes that too much or too little is not good for the health. Again, yung malnutrition, hindi po ibig sabihin nun is sobrang mababa. Both yan siya, either too little or too much. Kasi ang meaning ng mal is bad. Okay, we have here also vitamin-like compounds. These are some substances have physiological roles like vitamins, but they are present in larger amounts and are partially sensitized in the body. These substances include inositol, choline, and ubiquinine. Okay, quinone, sorry. Again, these are some substances that have physiological roles like vitamins, but they are present in larger amounts and are partially synthesized, okay, in the body. Okay. We have also the antivitamins or vitamin antagonist. Okay, mga kalaban, kontrabida. So these are substances that interfere with the absorption and functioning of the vitamins. They need to be similar in chemical composition as the vitamin they antagonize. So example nito is avidin, which is against sa ating biotin, and thiamine, which is against sa ating thiamine or vitamin B1. Again, ito yung mga substances na nag-i-interfere or kinakalaban niya yung absorption ng certain vitamin at kanyang function. So, mangyayari, hindi nila nagagawa yung role nila pag meron tayong antivitamins or vitamin agonists. Okay, so we have two major classification ng ating vitamin. We have the fat-soluble and the water-soluble. So let's discuss also the fat-soluble vitamins includes the vitamins ADEC, okay? The vitamin A, the vitamin D, the vitamin E, and K. So fat-soluble vitamins can be absorbed in the presence of fat and stored in the body. So from the word fat-soluble, they are stored in the body. Okay? They are stored in the fats of our body. So ito siya, mateo pa kapag stay of vitamin na yan sa lawas tano, it's because they are stored in the body. Compare sa ating water na naiilabas natin siya through urine. So fat-soluble vitamins generally have precursors or provitamins. Again, they have precursors or provitamins. So, they can be stored in the body and deficiencies are slow to develop. So, niya ito kumbaga na mate kapag develop o deficiencies tano sa certain na vitamin saya, okay, the ADEC, compare sa ating water soluble. Sa water soluble na marami yung cases na nagkakaroon ng deficiency, it's because madali siyang mailabas sa ating katawan. So this is stable especially in ordinary cooking method, okay? So next classification is the water soluble. So water soluble must be supplied every day in the diet kasi nga they cannot be stored for long term sa ating body. They do not have precursor, that is precursor ha. Precursor. Basta. Okay? So, they do not have precursor, they are not stored significantly in the body, and any excess is excreted in the urine. Deficiency symptoms develop relatively fast, and being water soluble, they are most likely to be destroyed in ordinary cooking. Hindi katulad sa ating fat soluble. Okay, so let's discuss first the four important fat soluble vitamins or the vitamin ADEC. A, D, E, and K. So let's discuss the vitamin A or the retinol. Vitamin A is a group of compounds that play an important role in vision, bone growth, reproduction, cell division, and cell differentiation. It helps regulate immune system, which help prevent or fight off infection. It also help lymphocytes, okay? 'Di ba? Yung lymphocytes is a part ng ating WBC. So it also helps lymphocyte fight infection more effectively. Vitamin A promotes healthy surface linings of the eyes and the respiratory, urinary, and intestinal tracts. It helps also the skin and mucous membranes function as a barrier to bacteria and viruses. So if you can remember sa ating community health nursing, isa sa mga activity ng nutrition program is giving vitamin A to pregnant women and vitamin A for the children. Bakit? 'Di ba? Ito yung mga functions niya. Ang dami-daming functions ng ating vitamin A. And also, sa ating IMCI, sa na-discuss natin for the IMCI, binibigyan din natin yung mga patient ng vitamin A pag merong measles, okay, lagi dito nagkakasakit sila, binibigyan natin sila ng vitamin A because the vitamin A, one of the responsibles or roles ng ating or functions ng ating vitamin A is tinutulungan tinutulungan niya ang ating immune system na mag-regulate and then to fight off infection. So, vitamin A, or these are the found in foods that come from animals called preformed vitamin A. Okay, again, pag yung preformed vitamin A, sila yung mga found, okay, in foods that come from animals. Okay, preformed vitamin A. Yung provitamin A naman, sila naman yung vitamin A that is found in colorful fruits and vegetables. Again, pag sabihin nating preformed vitamin A, sila yung nakikita sa ating animal meats. Okay? And then, the provitamin A, sila naman yung nakikita natin sa mga colorful fruits and vegetables. Okay, so there are two forms of vitamin A available in the human diet. The preformed, found in meat, poultry, fish, and dairy products. And the provitamin A is found in fruits, vegetables, and other plant-based products. The most common type of provitamin A in foods and dietary supplements are or is beta carotene. So usually kailangan ka sa mga ano yan? Orange, sorry, carrots. Okay, sa may alala, madakala content yan ng carotene. Okay, so what are the functions? Another functions ng ating vitamin A. It is used for vision cycle, necessary material for maintenance, growth and development, bone development, reproduction. So, deficiency of this vitamin may cause night blindness and eye lesions. Okay, it can also causes retarded growth, lower resistance of infection, faulty skeletal and dental development, and skin lesions or yung tinatawag nating farinoderma. Okay, farinoderma. So, makikita siya sa ating, ano to, libro. Okay, sa ating vitamin A, yan. We have here vision cycle. Okay, deficiency, eye lesion. Okay, eye lesion is a condition that is most critical in vitaminosis A. The cornea of the eye is affected early and the lacrimal glands fails to function, followed by keratinization and rupture of the corneal tissues. Okay, skin lesions, which is characterized as the food skin, clinically known as frenoderma. Sorry, that is frenoderma. Wala tong A. Okay? Frenoderma. So, skin lesions appear as dry and rough skin with popular eruptions occurring around the hair follicles. The sites of dermal changes are usually in the thighs, abdomen, and upper arm and back. Okay, so toxicity of vitamin A may cause liver damage, mild dermatitis and hair loss, headaches. Okay, we have here vomiting, double vision, nausea and vomiting, thickening of the skin with peeling off, swollen and painful long bones, coarse sprayers hair, and enlargement of the spleen and liver. So in young girls, pag sobra-sobra yung vitamin A mo, this may lead to cessation of menstruation. Kumbaga na, kada so menses o babay. So we have also condition called the hypercarotenemia. On page 62 to ha, mababasa nyo. Hypercarotenemia, it is the ingestion of large amounts of foods containing carotene merely results in deposition of carotene in the tissues, particularly the eyes, the skin, and gives the person a disturbing yet harmless orange appearance. Yan, gira sobra-sobra so intake ng ating vitamin A, nagkakos siya na hypercarotenemia. So, nagsasobra yung carotene sa kanyang blood. So, what are the food sources ng ating vitamin A? We have fish, green and yellow fruits and vegetables, and milk products. We have also sa preformed vitamin A, animal sources, liver, egg yolk, milk, cream, butter, and cheese. For the fortified margarine or skim milk fortified with vitamin A are common foods that are ideal carriers of this of these vitamins. For fishes, pwede yung dilis, clams, mussels, or tahong, and other shellfish. Okay? So, adult requirements ng ating vitamin A. So, for men, kailangan meron tayong ano yan? Sorry, 1,000 microgram of retinol, and for women 800 microgram of retinol. So, yun ang ating vitamin A. So next, let's discuss the vitamin D or the calciferol. It is called the sunlight vitamin because the body produces it when the sun's ultraviolet rays strike the skin. So pag natatamaan tayo ng ating UV rays, okay, napuproduce to ng ating katawan. Kaya tawag sa kanya ay sunlight vitamin. The only vitamin in the body that this vitamin D is the only vitamin the body manufactures naturally and is technically considered hormone. Okay? Isa to sa nagre-regulate ng calcium level sa ating blood. Okay? Itong vitamin D kasama ng ating parathyroid hormone and our calcitonin. So, parathyroid hormone, the calcitonin, and also this vitamin D controls the level of calcium in the body. So, it is important for the proper absorption of calcium from food, and it is vital for the control of levels of calcium in the blood, and also controls the rate at which the body excretes calcium in the urine. So, yan. Again, si vitamin D ang nag-iisang vitamin na manufacture ng ating katawan naturally. And paano nga na manufacture to pag natatamaan tayo ng UV rays. Okay? So what are the functions ng ating vitamin D? It aids for the absorption of calcium and phosphorus, and it is essential for normal growth and development. So what are the food sources ng ating vitamin D? We have bone meal, sorry. We have egg yolk, organ meat, butter, cod liver oil, and fatty fish. So adult requirements for vitamin D or calciferol, 5 microgram which age of less than 50 years old, 10 micrograms para sa age 51 to 70, and then 15 microgram for more than 70 years old. So what are the causes of deficiencies or toxicity of vitamin D in the body? For deficiencies, it may cause tetany, okay? Tetany or a syndrome characterized by abnormal muscle twitching, cramps, and sharp bilateral spasms of joints in the wrist and ankles. It may also causes rickets, okay? Rickets in children is the severe form manifested in defective bone and retarded growth. Bones become soft, so yung nangyayari sa rickets, yung bones nagiging soft, fragile, and deformed, such as pigeon-breasted, knock-kneed, bow-legged, malformed teeth, and rachitic rosary-like chest, and in latter it becomes or the ends of the ribs are rounded and become beaded. So ito yung nangyayari. Ayan. Yan yung nangyayari sa mga batang may rickets. Okay? We have also osteomalacia. Okay? In which osteomalacia, ito yung term, correct spelling niya. Letter S, Malaysia. So, instead of S yan siya, C yan siya ha. Pasensya na talaga sa typographical error ng aking PowerPoint presentation. Okay? So, osteomalacia. So, the term used for deficiency is osteomalacia, which means softening of the bones. So, for toxicity, okay, it may cause kidney stones, kidney damage, muscle and bone weakness, polyuria or excessive urination, weight loss, and hypercalcemia or the increase of calcium in the blood. So, yan yung ating vitamin D. So, sa libro ninyo, makikita nyo yung mga reference or recommended vitamin D intakes for specific population group. So, you may scan your books and then refer to it kung ano ba yung mga reference. So, yan yung andi dito yung population group, yung age, and then yung reference weight nila, and then the RNI, okay? Or yan yung kanilang recommended nutritional value. Okay? So next, let's discuss the vitamin E or the tocopherol. Tocopherol, vitamin E. Okay? So what are the functions ng ating vitamin E? So it is used, okay, para sa mga aging retardation, okay, para hindi masyadong mabilis yung pag-age ng isang tao. 'Di ba? So mayra E na effective para plumpier yung skin na hindi na bumayta matoa ka kailer ka o tao. We have also anti-clotting factor. It has diuresis factor, fertility, okay, lung protection, male potency, muscle and cell nerve membrane maintenance, and serum cholesterol reduction. Okay, ano yung mga sources ng ating vitamin E? We have butter, dark green vegetables, eggs, fruits, nuts, organ meat, vegetable oils, wheat germ, and wheat germ. So for adult requirements, we have 15 milligrams. So 15 milligrams ang ating vitamin E, okay? So another function ng ating vitamin E, it has a antioxidant function in which it acts in vitro as a lipid antioxidant. It prevents the formation of peroxides from polyunsaturated fatty acids, thus preventing the oxidation of unsaturated fats. Vitamin E also helps enhance the activity of vitamin A by preventing its oxidation and loss of activity in the intestinal tract. Vitamin C in foods is similarly protected when vitamin E is present. Present. It helps sustain tissue integrity, especially structural parts containing unsaturated lipids. Okay, so yan si vitamin E. Okay, so deficiencies of vitamin E may cause red blood cell hemolysis, okay, which is nagkakaroon ng breakdown, mabilisang breakdown ng ating RBCs. Okay, we have also edema and skin lesions. Okay, so it may cause also increased urinary excretion of creatinine and decreased excretion of creatinine. So toxicity or hypervitaminosis E has not been reported largely because the nutrient could not be stored to a large extent in the body. Also, its presence in food is not widespread. Whatever concentrated forms are available are not common. So, hindi siya common, but pag dumating sa part or point talaga na tumaas or nagkaroon ng toxicity ang ating vitamin E, they may cause vomiting, albuminuria, and hemolysis. Okay? So now let's discuss the vitamin K or yung tinatawag nating menadione or phylloquinone. Again, they are called also known as menadione and phylloquinone. Okay, so what are the functions ng ating vitamin K? It it is used in liver synthesis of prothrombin and other blood clotting factor. So, if you can, if I don't know if na-discuss na isa inyo yung ating EINC or the essential intrapartum newborn care. So, EINC, isa sa mga ginagawa ng mga nurses pag naipanganak yung baby is nagbibigay tayo ng vitamin K shot, okay, through vastus lateralis IM siya. Bakit tayo nagbibigay? Is this prevents hemorrhage sa mga bata. 'Di ba? Remember na pinutol yung kanilang um, umbilical cord. So to prevent the hemorrhage, okay, para hindi magkaroon ng hemorrhage yung bata, nabibigay tayo ng vitamin K para magkaroon ng formation ng blood clot. So what are the sources ng ating vitamin K? It includes green leafy vegetables, safflower oil, yogurt, liver, and molasses. Okay. So adult requirements for men, we have 80 microgram, and for women 65 microgram. So another function ng ating vitamin K. So vitamin K is necessary for the maintenance of prothrombin level in the blood plasma. The coagulation of blood is a series of reactions that depend on several factors. Vitamin K is also needed in the synthesis of proconvertin. Vitamin K is needed for phosphorylation, a chemical process that adds phosphate radical radical to glucose so that its passage through the cell membrane is hastened. So vitamin K is fairly resistant to heat, but sunlight destroys the K. It is not destroyed by ordinary cooking methods, but being fat soluble, vitamin K is not lost in cooking or boiling water. All vitamin K compounds tend to be unstable to all alkali. Okay? So, we have different types ng ating vitamin K. We have vitamin K1, K2, K3, K4, and K2, K1 hanggang K4. So, K1 is phylloquinone or phytonadione. We have vitamin K2, minaquinone, vitamin K3, menadione, and then vitamin K4, menadiol. So, what are the sources for vitamin K1? We have plant spinach, Swiss chard, cabbage, kale, cauliflower, broccoli, and sprouts. For vitamin 2, vitamin K2, gut fermentation natto. Vitamin K3, synthetic. It is ginagawa siya synthetically. And also for the vitamin K4. So, what are the, ano yan? What are the ano yan? Effects pag kulang ang ating vitamin K or sobra-sobra ng vitamin K. For deficiency, it may cause hemorrhagic diseases sa ating mga newborn and may cause delayed blood clotting time in adults. Okay? So, pag kasi, niyan, pag poor kasi yung blood clotting factors natin, it will lead to hemorrhage. Okay? So, excessive bleeding. So, pag sobrang pagbe-bleed natin, nakukulangan tayo ng blood. For toxicity, it may cause vomiting, hemolysis, albuminuria, or a condition called kenecterus. Okay? Kenecterus on page 70, kabati irons kanyan. Okay. Wait, sulat ko na lang dito. Kennicterus. Connectors. A condition resulting from the accumulation of bile pigments in the gray matter of the central nervous system. Again, it is a condition resulting from the accumulation of bile pigments in the gray matter of central nervous system. Okay, so yan ang ating uh, discussion with regards sa ating fat-soluble vitamins. Okay? So, next, let's discuss the water-soluble vitamins. Okay, so pinakilalang unang water-soluble vitamins is the vitamin C. Okay, so water-soluble vitamins are vitamin C or ascorbic acid and the B-complex vitamins. Again, si vitamin C at saka yung B-complex sila ang ating water-soluble. Vitamin C is called the fresh food vitamin since it is found in the growing parts of plants. Plants. All raw fresh fruits and vegetables contain ascorbic acid in varying amounts. Vitamin C performs a number of biological roles as well as serves as an antioxidant. The B-complex vitamins is important in human nutrition are the B-complex that are important, okay, sa ating nutrition is thiamine, riboflavin, vitamin B6, vitamin B12, niacin, folic acid, pantothenic acid, choline, inositol, and biotin. They are found together in nature and generally have related functions, although they are chemically unrelated. So let's discuss the vitamin C muna, or the ascorbic acid. So ano yung function ng ating, ilan sa mga function ng ating vitamin C? We have here for the collagen production. So di ba yung ating collagen is para yan sa ating bone production and then sa ating skin. So basically, more on siya or nakakatulong siya sa tissue integrity. So, we have here bone and tooth formation, iodine conservation, healing, RBC formation, and infection resistance. So, what are the sources ng ating vitamin C? We have here fresh fruits and vegetables. Okay? So, for adult requirements, for men, kailangan natin ng 90 microgram na vitamin C, and for women, 75 microgram. So, vitamin C can also prevent skin aging. Okay, so on the page 71, makikita niyo yung different physiologic functions ng ating vitamin C. So it is needed in the formation and maintenance of intercellular cementing substances. So nagiging binder sila. So you should read that one. Okay? So deficiency and toxicity of vitamin C. In deficiency of vitamin C, okay, it may cause scurvy or yan yung meron, ano yan, scurvy is a condition in which mababa yung vitamin C mo sa katawan that may cause bleeding, swollen gums, loose teeth, swollen and tender joints, internal hemorrhages underneath the skin, capillary fragility, and megaloblastic anemia. So it may cause joint pain, lowered resistance to infection, rough skin, lack of appetite, general weakness, and irritability. For toxicity, it may cause so there is no toxicity or hypervitaminosis C since the vitamin cannot be stored in the body. Pero pinaka-list lang na chances if ever man na mag-cause ng hypervitaminosis ng vitamin C, it may cause diarrhea, bloating, cramps of kidney stones. Okay, sobra-sobra yung ating kidney stones. So, next, let's discuss the vitamin B complex. Okay? By the way, sa table 14 on page 74, makikita ninyo yung mga vitamin C values of common food sources in serving portions. So, dito nyo makikita in milligrams, ilan yung nakukuha natin sa mga fresh foods or fresh foods na usually malaking sources ng ating vitamin C. So now let's discuss vitamin B complex. So all vitamins B help the body convert food or the carbohydrates into fuel or glucose, which is burned to produce energy. Again, the vitamin B, sila yung nakakatulong sa ating katawan para ma-convert ang ating carbohydrates into fuel or glucose. It all helps the body to metabolize fat and protein. It also helps the nervous system function properly and are necessary for optimal brain function. This vitamin B complex or all B vitamins are water soluble, meaning the body does not store them. It is a group of water soluble vitamins that need to be continually replaced because of their short life. Okay? So, hindi masyadong mahaba ang kanilang buhay. Madali lang silang mawala sa ating katawan. Okay? Again, they are burned to produce energy. Okay? So, first, let's discuss the vitamin B1. Okay. Isa sa kasama sa ating vitamin B complex. So, vitamin B1 or thiamine is considered an anti-stress vitamins because it may strengthen the immune system and improve the body's ability to withstand stressful conditions. Okay, gilalay dito ko na pero may ka-expose sa stress, okay, pwede din to daw siya. So, sa stress tabs na usually na tatagun roon na vitamin B complex at saka vitamin E. Yan yung mga nagsusuppress ng stress and nagpapaganda ng ating skin or pangangatawan if you are really exposed to stressful conditions. Okay? It was named B1 because it was the first B vitamin discovered. So siya yung first na B vitamin complex na na-discover. Okay? So, ano yung functions ng ating vitamin B1? It is helpful in appetite stimulation. Okay, para maganda yung appetite ninyo. So, yung mga gustong magpapataba dyan, okay, dahil sobrang payat, and then, kasi bakit payat? Kasi hindi masyadong maganda yung pagkain nila. So, you consider taking vitamin B complex. So, we have here blood building, carbohydrate metabolism, circulation, digestion, growth, learning activity, and muscle tone maintenance. So, what are the sources ng ating vitamin B1? We have meat, fish, poultry, molasses, brewer's yeast, brown rice, nut, wheat germ, whole and enriched grains. So, for requirements, for an adult man, 1.2 milligram, and for women, 1.1 milligram. So, what are the causes of vitamin B1 deficiency and toxicity? For deficiency, it may cause condition called beriberi. Siguro napapansin niyo sa mga maugat na so di kakuanan sila na beriberi, may maalala sila ni AE. Okay, so it is also called as nutritional polyneuritis, yung namamaga, yung kanilang mga veins, okay, lumalaki siya and then it's really visible. Okay, very, very. Or also known as nutritional polyneuritis. We have also mental confusion, fatigue, edema, impaired growth, and enlarged heart. Okay, so yan yung mga uh, pwedeng cause ng ating vitamin B1 na deficiency. For toxicity, there are no toxic reactions of excessive thiamine intake in the body. Also, dito sa ating libro on page 78, we have here the different types of beriberi. We have the infantile beriberi, we have the wet beriberi, and we have the dry. Sa infantile, sila yung usually occurs in infants 2 to 5 months of age whose main food is milk from a mother suffering from beriberi. Okay, so sometimes symptoms are loss of voice or aphonia, whining cry, bluish discoloration of infant or yan yung tinatawag natin cyanosis, difficulty in breathing, and even death in a few hours. So wet beriberi naman is evidenced by edema of both lower extremities which progresses upwards to the body cavities such as abdomen and chest. Actually, beriberi is not good in pregnant woman kasi it may lead to niya, not hindi magandang delivery ng isang bata. And also, 'di ba, siguro pwede rin na magkaroon ng infantile beriberi. The heart is enlarged and the heartbeats become irregular and there is also difficulty in breathing. The dry beriberi involves the peripheral nerves, so there is a feeling of pins and needles or yung paresthesia in toes and gradual loss of touch sensation, muscle weakness, and finally, paralysis. Okay, so yan yung mga effects ng deficiency ng ating vitamin B1. So, we have also here the Wernicke-Korsakoff syndrome, which is a brain disorder caused by thiamine deficiency. Wernicke's disease involves the damage to nerves in the central and peripheral nervous system and is generally caused by malnutrition stemming from habitual alcohol abuse. Wernicke-Korsakoff syndrome na usually nakikita to sa mga alcoholic na nagkakaroon ng alcoholic withdrawal. Kaya nag-withdrawal sila kasi 'di ba nag-stop, nag-win, dinatry nilang mag-win ng alcohol, so nagkakaroon ng withdrawal symptoms, nakikita tong Korsakoff. So Korsakoff syndrome is characterized by memory impairment and nerve damage. Again, they are caused by thiamine deficiency. We have also cataract, which is a preliminary evidence suggests that thiamine along with other nutrients may lower the risk of developing cataracts. For Alzheimer's disease, so, lack of thiamine can cause dementia in Wernicke-Korsakoff syndrome, and it has been proposed that thiamine might get help reduced severity. So, pwede daw makatulong tong pag-intake ng thiamine na ma-reduce yung severity ng ating Alzheimer's disease. For heart failure, low levels of thiamine can lead to wet beriberi, which is a condition where fluid builds up around fluid. So, dapat hindi masyadong mababa yung take mo ng vitamin B1. Next, let's discuss the vitamin B2 or riboflavin. What are the function of our vitamin B2? It is for antibody and red blood cell formation, energy metabolism, cell respiration, eye and mucosal tissue maintenance. It also works as an antioxidant by scavenging damaging particles in the body known as free radicals. So, yung mga free radicals, if you can still remember ang ating free radicals, theory of free radicals na as we age, merong mga ano yan, excess na mga chemical sa ating katawan na walang partner, yan yung tatawag nating free radicals, na pag nagbi-build up yun siya, mas napapabilis yung ating aging process. Okay, so what are the sources ng ating vitamin B2? We have meat, fish, poultry, milk, molasses, brewer's yeast, eggs, fruit, green leafy vegetables, nuts, and whole grains. So what are the adult requirement for men? 1.3 milligram and for women 1.1 milligram. So the deficiency of vitamin B2 can cause fatigue, slowed growth, digestive problems, cracks, and sores around the corners of the eye. And then also fatigue. So yan yung mga itsura ng mga patient na mababa or decrease ang kanyang riboflavin. So, a riboflavinosis is characterized by tissue changes, particularly in the skin, eyes, nose, and tongue. The skin develops seborrheic dermatitis, or a scaly, greasy skin with burning sensation and corneal vascularization or extra blood vessels over the cornea. Vascularization gets so severe that so there is a accompanying photophobia, okay? So nagkakaroon sila ng problem with the ano yan, bali sensitive sila sa light, okay, and dimness of vision. The tongue is swollen and becomes magenta red or glossitis. The other lesion is called cheilosis when lips are swollen and the corners of the mouth are cracked. For toxicity, so it does not occur. So toxicity of riboflavin does not occur from oral doses, but is possible when massive doses are given by injection. However, its ill-defined effects are not serious as what experienced in hypervitaminosis A and D. Okay. So, yan, riboflavinosis are characterized by tissue changes, particularly in the skin. Okay, it is a condition na mababa yung immune riboflavin. We have anemia. Children with sickle cell anemia tend to have lower levels of certain antioxidants, including riboflavin. Also, for cataract, vitamin B2, along with other nutrients, is important for normal vision. And preliminary evidence shows that riboflavin might get help prevent cataract. So lahat ng pinapaniwalaan na lahat ng B complex, okay? B2, B1 and along other nutrients, nakakatulong sila para makaprevent ng cataract. Okay. Next, let's discuss vitamin B3 or niacin. So, what are the function ng ating vitamin B3? We have circulation, cholesterol level reduction, growth, hydrochloric acid production, metabolism, sex hormone production. So, what are the sources? Eggs, lean meat, milk products, organ meat, peanuts, poultry, seafood, and whole grain. So, adult requirement for men, 16 milligram, and for women, 14 milligrams. So, causes ng vitamin B3 deficiency. Okay, yan yung mga cause niya sa ating katawan. We have here pellagra. Okay. uh, sa page, saan ba to? Niacin or nicotinic acid. So, sa page 483, we have here pellagra or a classical deficiency disease characterized by 4 Ds. Meron siyang dermatitis, diarrhea, dementia, and even death. The skin changes are different from other types of dermatitis because of the blackish or dark, scaly patches that appear symmetrically in the areas exposed to sunlight called bilateral dermatitis. The tongue is beefy red and swollen and the corners of the eye are cracked and angular or the angular stomatitis. So, ito yung nagiging kanya. Again, for this, dermatitis, diarrhea, dementia, and even death. So, toxicity ng ating vitamin B3 can cause flushing, gastric ulcers, low blood pressure, nausea, vomiting, diarrhea, liver damage, and may also cause paralysis in the respiratory center. So, next let's discuss the vitamin B6, okay, or the pyridoxine. So, pyridoxine plays an essential role in many of the complex biochemical processes in which foods are metabolized by the body. So, other functions may include antibody formation, digestion, fat and protein utilization, amino acid metabolism, and hemoglobin production. So, what are the sources ng ating vitamin B6? We have here meat, poultry, bananas, molasses, brewer's yeast, fish, green leafy vegetables, peanuts, raisins, walnuts, and grains. Adult requirement for men, we have here 1.3 milligram for ages less than 50 years old, and then 1.7 for more than 50. For women, 1.3 milligram for less than 50 years old, and 1.5 milligram for more than age of 50 years old. So deficiency of vitamin B6 may cause dermatitis, glossitis, seizure, or anemia. But remember, no deficiency state has been observed in an adult by dietary depletion. Induced experimental deficiency by injecting an antagonist results in nausea, vomiting, seborrheic or oily dermatitis, glossitis, conjunctivitis, and depressive moods. So in infants, the deficiency state, which results from feeding them milk formula lacking in pyridoxine for several weeks, causing irritability, poor growth, anemia, and convulsion. For toxicity, which are also only observed sa mga rats, may cause depression daw, irritability, headaches, and fatigue. Di ko alam paano nila to na-observe, but um, syempre, may mga lab rats and all. So, alam niyo naman na ginagamit yung mga lab rats para makita ba kung is it safe for humans na closer to humans in experimental. Okay? So, next, let's discuss the vitamin B12. Okay? Or the cobalamin, si vitamin B12. So, vitamin B12 is used or functional, okay, or essential for normal metabolism and growth of all cells, especially those in the GI tracts, bone marrow, and nervous tissue. So they are used for blood cell formation, cellular and nutrition metabolism, iron absorption, tissue growth, and nerve cell maintenance. So what are the sources ng ating cobalamin? We have beef, eggs, fish, milk products, organ meat, and pork. For adult requirement, we have 2.4 micrograms. So the deficiency of our it is also involved in myelin formation or yung myelin sheet sa ating brain. So, ano yan? Deficiency may cause indigestion, diarrhea, and constipation, weight loss, microcytic anemia, fatigue, poor memory, irritability, paresthesia of hands and feet. So, pwede din magkaroon ng pernicious anemia. Okay, pag sabi natin pernicious anemia, yan yung pag-decrease ng cobal. It is anemia that caused by decreased cobalamin or vitamin B12. So, demyelination of the large nerve fibers of the spinal cord. For toxicity, none. Okay, no toxic effects are known. So, next, let's discuss pantothenic acid. Okay. Pantothenic acid is functional against or used in antibody formation, cortisone production, growth stimulation, stress tolerance, vitamin utilization, conversion of carbohydrates and fats and proteins. So what are the sources ng ating pantothenic? Pantothenic, we have here eggs. Ito. Meron na naman akong pantothenic. Again, pantothenic acid. So sources includes eggs, legumes, mushrooms, organ meats, salmon, wheat germ, whole grains, fresh vegetables, and yeast. For adult requirements, we have 5 milligrams. So deficiency, okay? Pag may deficiency sa ating pantothenic acid, may cause insomnia, muscle cramps, tingling sensation of the extremities, or vomiting, or it may cause general failure of all body systems. For toxicity, none or no toxic effects of this substance are known. Okay, next let's discuss biotin. Okay, biotin. So biotin, it serves as coenzyme factor in carbon dioxide fixation or CO2 for fixation. It is used for cell growth, fatty acid production, metabolism, vitamin B utilization, skin, hair, and nerve and bone marrow maintenance. Okay? So together with active acetate or CoA, it helps in the synthesis of purines, pyrimidines, fatty acids, and carboxylation reactions. So sources ng ating biotin includes egg yolks, legumes, organ meats, whole grains, yeast, milk, and seafood. So adult requirement will be 30 microgram. Okay? For deficiency ng ating biotin. So in humans, true biotin deficiency does not occur even in poor diet. But if dumating man sa point na yun na nga, may mangyari, it may cause anorexia, fatigue, depression, dry skin, and heart abnormalities. For toxicity, no toxic effects of excessive biotin have been observed in humans. Okay, next let's discuss folic acid or folate. Okay. Folic acid plays a vital role in the transfer of one carbon units into the appropriate metabolites in the synthesis of DNA, RNA, methionine, and serine. The enzymes which utilize phelacine coenzymes are known as pteroproteins. It is required for one-step conversion of histidine into glutamic acid. It is also needed for cell growth and reproduction, liver function, RBC formation, hydrochloric acid production, and protein metabolism. So what are the sources ng ating folic acid? So citrus, fruits, eggs, green leafy vegetables, milk products, organ meat, seafood, and whole grains. So itong folic acid na to is necessary also given to those pregnant women. Why? Kasi ito ay nakakatulong sa bata para ano yan, maiwasan ang problem with brain and spinal functions. Okay? Spinal cord function. So, adult requirements, men, 90 milligrams, and for women, 75 milligrams. So, deficiency ng ating folic acid. It may cause poor growth, megaloblastic anemia, and other blood disorders. We have diarrhea, microcytic anemia, confusion, depression, fatigue, GIT disturbances, impaired absorption, metabolic derangements. So, toxicity, it masks, okay, the vitamin B12 uh, deficiency. Parang katulad niya. Okay? So, ano to? I th- ah last na hindi ko naisali, okay, na isama sa ano to um PowerPoint presentation. Last three ha. We have here lipoic acid, or it is a sulfur containing fatty acid, and it is not true vitamin because it can be synthesized in adequate amounts in the body. However, it is like the other vitamins, a coenzyme factor or thiamine pyrophosphatase. Lipoic acid is a coenzyme in energy metabolism converting pyruvic acid into acetyl-CoA. The requirement for lipoic acid for humans is not yet set, although its biological role is known. The concentrated sources of lipoic acid are yeast and liver. So, it is also under siya sa ating ano yan, uh, more recently na discovered coenzyme factors na under sa vitamin B complex. We have also here the inositol, which occurs in meat and meat extractives, muscle and glandular organs, brain, legumes, nuts, and fruits and vegetables and grains. So dito sa ating page 91, ito yung group 4 other related factors or pseudo-vitamins. So it is abundant in the diet and minimum requirements for inositol are not known. Its chemistry is closely similar to glucose, hence it is alternatively called the muscle glucose. It is a lipotropic agent and it is linked with phospholipids as phosphoinositols, which help in the transport and metabolism of fat. Next, we have here also a choline. Choline is a lipotropic agent which metabolizes fat and prevents buildup of fatty acid. It is needed for fat transport as a constituent of phospholipids, namely lecithin, cephalin, and sphingomyelin. It also helps in the transmission of nerve impulses, and deficiency of choline results in fatty livers as seen in cases of chronic alcoholism and kwashiorkor. And the richest food source is egg yolk. Other good sources are liver, brain, kidney, heart, meats, legumes, nuts, and yeast and wheat germ. Okay? So, yun ang ating vitamin B complex. Okay? So, tapos na tayo sa vitamins. So, I think that this ends my discussion kasi masyado na tong mahaba. okay, for our discussion for today. So I want you to read the pages or the chapters na na-discuss ko, the chapter 7, water and electrolyte, and chapter 4, the micronutrients, which talks about the vitamins. Inshallah, in the next meeting, I will discuss the minerals. So I hope you have learned a lot from this video. If you have questions, feel free to ask. Okay? Pwedeng tanungin nyo ako sa bahay, ano, PM nyo ako, or pag makita nyo ako sa school kung may hindi kayo naintindihan sa na-discuss ko, you may also ask. Okay? So, thank you for watching this video and wassalam.